We will begin today's program with an intro from Al Campanella, president of Haney's Marketplace. Al?
Great. Thank you, Devin. Good afternoon, everyone. Al Campanella from the Haney's Marketplace. Glad to be with you today. Thank you for joining us. For some of you, it might be your lunch hour, so you might be eating your sandwich as well. That's fine. We will be sending out these slides, so no need to take copious notes as we're moving through. But we're very glad that you're here today. We have a very excellent presentation lined up. As you can tell, it's with our one of our newest partners in the Haney's Marketplace, Medictor. For those of you who don't know the Haney's Marketplace, we are a program within the association, the Healthcare Association of New York State, where we curate and endorse and promote on a very selective basis providers of services that we feel can be of great value to our Haney's members. And so we do that very selectively. I think if you logged on a few minutes ago, you saw the different portfolio of different partners that we have. So today it will focus, as you can see on your screen, with Medictor. And we have some very excellent panelists with us today, which I believe is the next slide. We have Dr. Arnold Do Rosario from the Yale New Haven Health System, Dr. Ronald Pope from New York here in the Mid-Hudson region from Columbia Memorial Hospital, and our principals that will introduce themselves from Medictor. So thank you for being here today. I want to remind you, as Devin just noted, you will likely have questions throughout the presentation today. Please feel free to type those questions into the Q&A channel on your Zoom screen. We'll get to those later on in the presentation. And of course, sit back and enjoy. And I'm going to turn this now over to the folks at Medictor.
Thank you so much for your kind words, Al. And thank you, Haney's and the team for coordinating and co-hosting this session with us. As you mentioned, today we're going to speak about Medictor, and we have a great panel also to discuss the implementation of Medictor. And basically, Medictor belongs to a space in the intersection of healthcare and AI that is becoming more and more relevant for key players in the industry. And I may say that American hospitals and health systems are among the most enthusiastic with the idea and the opportunities around AI in this industry. So today we are going to focus on the use of AI and the benefits for patients and healthcare organizations to improve patient experience, patient engagement, and care navigation. But before we start discussing our solution, we want to give you a brief overview of who we are for those that are not familiar with our company. Medictor is a global company that it's present in 30 countries and is currently covering over 30 million lives worldwide. And our footprint, our growing footprint here in the States, it's basically with hospitals and health systems, such as Columbia Memorial Health, part of Albany Med Health System, Bluestem Health, as well as American tech vendors, well-known tech vendors such as Teladoc for telemedicine, Core AI for conversational AI, Telemedic, etc. Elsewhere, mostly in Europe, Asia, and Hispanic America, we work with health plans, and we are partners with the top health plans such as AXA, Bupa, Mapfre, Munich Re, etc. So you may be wondering why all these great companies collaborate with us, right? So the main reason is because of Medictor addresses a pressing issue in healthcare, which is directing patients to the appropriate level of care, right? This is an area where organizations have been spending a lot of resources, time, money, etc., trying to educate patients and tell them what to do when they feel symptoms, right? Here we have a picture of a campaign that went viral, launched by Baker in Florida. They put these giant billboards on the highway trying to tell patients when they need to go to urgent care or emergency care, right? This may sound silly, but the truth is that patients, especially those without clinical background like myself, we don't know what to do when we feel symptoms, right? Obviously, the solution is not going to be papering up the whole city. It's going to be digital through your smartphone, laptop, etc. And the truth is that nowadays, patients/consumers are already checking their symptoms online. They either go to Dr. Google, despite the fact that we know it's a dangerous doctor. The most sophisticated go to ChatGPT, etc., right? So we thought, why don't we leverage this existing consumer behavior, which is basically going online to find out whatever they need and provide them with a tool that actually works, right? And this is how we came up with Medictor. Medictor is the most advanced AI-based medical chatbot that features unique triage and pre-diagnosis capabilities. What we do is basically empower patients by offering them on-demand, personalized healthcare guidance at the first onset of symptoms. And the way we do this is by partnering with organizations, right? So Medictor enable these organizations to direct patients to the appropriate level of care on a safe, convenient, and cost-effective way, anytime and anywhere. And throughout the years, we have been able to generate and implement value propositions that has proved to be successful here in the States among hospitals and health systems. One of them is basically identifying and directing qualified patients to your doorstep. At the same time, we streamline the patient journey by basically avoiding unnecessary steps and reducing wait times. And we have metrics that basically support this claim and this value proposition. Among others, I'd like to point out basically 3 times ROI if we compare the investment in Medictor and the revenue generated through this channel for the organizations. 40% user retention, meaning that 40% of the users are visiting Medictor and this channel on a recurrent basis. And a net promoter score of 72, which is 4 times the average in the industry. And let me spend just some seconds here because sometimes, especially organizations, when they are thinking of implementing digital health solutions, one of their concerns is, are they going to use it? By they, I mean the patients, the consumers. So these 2 metrics, the 40% user retention and the 72 NPS, goes in the direction of saying, yes, people are using Medictor, they love Medictor, and what's more important, they are promoting Medictor among families and friends. Apart from this value proposition, we have others that we are going to discuss throughout the panel that are more focused on efficiency and productivity of your staff. So you may be thinking how we are offering this service, right? So in a nutshell, what we are doing is basically providing this free text where the patient is going to input with her own plain words how she feels. No need for, fancy and clinical vocabulary, layman terms, that works. We understand that. The machine understands that. And that's going to trigger a process of around 14 questions and less than 2 minutes. And then we are going to be basically sharing a last screen with the patient, which is a recommendation scheme that is going to tell or suggest this patient what are the recommended next steps. Obviously, this last screen and the recommendation is going to be always according to the protocols and guidelines of the hospital and health organization we are working with. Just to give you an example, let's say that a patient that is using Medictor ends up having a case that is considered low urgency. And the protocol in this case is basically suggest this person to use telemedicine, right? To access healthcare as more convenient. Or on the contrary, if we identify that this is a high level urgency, then provide directions to the closest urgent care facilities. Since our solution can be geolocated, we can actually tell this person where needs to go anytime and anywhere. So you may be thinking how we are able to offer this user experience, this seamless user experience to the patients. So it's thanks to a sophisticated technology that very important we have developed from scratch, and it's proprietary technology. And there are a few elements that I'd like to point out. There are multiple angles, but there are 4 that I think that are worth sharing with you today. The first one is the depth and breadth of the solution. We cover over 950 conditions. Basically, virtually is all the conditions you are going to find in the emergency department in an urban area in a Western country. Apart from that, secondly, we have a powerful NLP, the machine that understands whatever the patient is inputting in the free text. This NLP can virtually understand anything that has to do with signs, symptoms, and conditions. Actually, it's powered by 45,000 synonyms per symptom for symptoms, and it's available in 17 languages nowadays. Some of the features of this NLP is basically, as mentioned, you can use your own plain words. You can input as many symptoms as you want at once. And this is very important when it comes to the user experience, because other companies in the space are going to make you select from a preset menu or make you select from a body map. This, the free text, is the best way to gather as much information as possible from the case. People can actually do typos. We are going to recognize them. And since we are very committed with health equity, our solution can be used by everybody, regardless of the level of literacy. Everybody that has completed a grade 7 in the States can use our solution. Our solution is white labeled, so at all times, your patients are going to be in your environment. Nobody knows about Medictor. It's going to be your look and feel, your logo, etc. And as important as all the languages is the fact that our solution is omni-channel, meaning that it can be powered either through the most sophisticated channel voice recognition to the most traditional SMS text technology. And this is very important because the same way patients have a preference when it comes to language, they have a preference when it comes to device. So I may prefer to use my smartphone and Fred may prefer the laptop, right? So it's very important when we are talking about access to healthcare to make sure that we provide this in the language and channel most appropriate for every patient. And last but not least, it's the clinical validation of Medictor. One of the co-founders of Medictor, Dr. Garcia Esquirol, was very clear himself when he said that he wanted this to be a solution, a tool that works, and that we had to go through the same process that new medical devices has to go through before going into the market, right? And this, the gold standard in the industry are the clinical studies. And in our case, they were carried out by independent third parties responsible for creating the protocol, gathering data, creating the documents, etc. Secondly, it was done with real patients in hospital settings. And finally, got the attention from peer-reviewed magazines that have published those results. Here, there are some basically testimonials from existing clients / partners that we are very proud collaborating with. And it's our vision that in the near future, in the real near future, no one will visit a health professional without evaluating themselves first with the use of AI. And we hope that we can count on you on this exciting journey to improve access to healthcare here in the States. That brings me to the end of my presentation. And now I'm going to leave you with Fred Pineiro, Medictor Chief Growth Officer for the US market, and the panelists. Thank you so much.
Thank you, Vicente. Appreciate that presentation. Folks, just a reminder that if you have any questions, feel free to put them in the Q&A. I want to also thank Haney's for helping us organize this event and hosting. We really appreciate all the efforts that you put into this. Obviously, I want to also thank our panelists, Dr. Del Rosario and Dr. Pope. I know you have very busy schedules, and we really appreciate you taking the time to represent your organization, but also talk a little bit about Medictor in this meeting. And obviously, also want to thank everyone that's attending. You know, you have very busy schedules, and we appreciate you taking the time to be here with us today. Really, what I'd like to do is maybe start off with a little bit more detailed introductions of our panelists. So why don't we start with Dr. Pope, if you would, if you could tell us a little bit more about yourself, your organization, and your role.
Sure. So, you know, and interestingly enough, when the panelist information, it lists me as the Chief Medical Officer at Columbia Memorial Health, which is part of the Albany Med Health System. However, as of February 1st, so less than 2 weeks ago, or about 2 weeks ago, I switched roles. I'm currently a VP with the hospital, but I'm only part-time. I went into semi-retirement mode and down in Florida now. But I've been involved with Medictor since the onset, and working with Vincent pretty closely, and just recently handed the reins off to our IT department. My role, you know, I'm a family physician. I've worked in the clinical field for many, many years, hence the retirement, and in the administrative end. So I've got both ends of that spectrum, and I think that's played a role in how we're utilizing Medictor and some of the vision that we had with that, which we can talk about a little bit further on.
Thank you, Dr. Pope. How about yourself, Dr. Del Rosario?
Yeah, good morning. I'm Arnold Del Rosario. I'm an internist. I joined the Yale Health System 10 years ago, served as Chief Medical Officer, and like Dr. Pope at this point, I'm on a reduced capacity. I still see patients, and I serve as Chief Population Health Officer. I also served on the Strategy and Innovation Committee of the Yale Health System, during which time we evaluated many vendors, and I've been involved with Medictor pre-COVID.
Great, thank you, Dr. Del Rosario. Al, you introduced yourself earlier, so maybe I'll start with you with the first question, if I may. And just if you could give us a little bit more thoughts around what were some of the driving factors in your decision to partner with Medictor. You're currently on mute.
Sure, Fred. And thank you, everyone, for joining us again today. Well, in my background, I've spent over 35 years predominantly on the health system side of the world. So sitting in some of the chairs that you're sitting in today, and have seen firsthand really a great evolution of what we're seeing in healthcare. And there's no denial that advances do take time to be introduced into the mainstream. And I think one of the roles of us as leaders in healthcare is to try to, facilitate new technologies, new ways of doing things. And we live in a post-COVID world, right? And I think what we saw during the COVID period, which was really, 2 years plus, is a real shift in how technology could be used. We have a great evolution of artificial intelligence. In particular, this particular type of use of artificial intelligence has been around for at least a decade. And so I think it's important in my career personally, as well as through Haney's, is to try to promote what's in the future. And this is part of the future today. And so when you look at healthcare, and what I think drives us to select certain partners, we call them, is really what they can provide. And we know healthcare is very always local, and there has to be a strong element of trust. And so now all of a sudden, in the old days, you didn't have these electronic ways to check your symptoms and to help, pre-diagnose where you might be in your health journey. Now these tools are available. And so how can health systems, in particular, adopt them in a meaningful way, personalize them, obviously, as you heard earlier with your branding, but trust them that they are part of the care delivery system. And so it's important to understand really what's driving this technology, the competencies of those creating, in this case, this our partner here today. And they're encouraging that sense of trust. We also learned during COVID and post-COVID how important efficiency is, and that patients want efficiency, people want instant answers, they want convenience, and we know the workforce has gone through a tremendous amount of stress, and how do we make their lives a little bit easier by helping with triage so that patients can be seen at the right time at the right level of care. So I think all that is wrapped into really our discussion today on this particular technology and service, and it really ties back, when you really think about it, to the quadruple aim, right? We're all familiar with that, right? So whenever a new technology and solution is under consideration, you always have to sort of filter it through that, right? And so you're looking at, does this ease access? Does it reduce costs? Does it create efficiencies? Especially important, and I'm sure our physicians here will speak to this, is around outcomes. Does it get care faster? Does it get person on track more quickly? Is the patient experience of higher quality? And then I mentioned, like, the fourth aim, of course, would be around the workforce benefits, especially in an emergency room application, for example. So I think for all these reasons, I know that personally I found this solution very attractive. It had crossed my radar many years ago. And in my role here at Haney's, when we were considering different solutions to introduce into the Haney's marketplace, this, based on our analysis and review of different others, we found this was really an excellent match. So pleased that we've been able to do this call today, and I think I'm interested in hearing also, again, for all of us here, is how AI is really a critical part of the underpinning of the solution.
Great, thank you so much. I really tuned in and wrote down, the healthcare is local and it's from someone you can trust. I think that's, I totally agree. Couldn't agree more with that. So I appreciate your comments there, Al. Let's move on now to Dr. Del Rosario, if we can. And from your perspective, Dr. Del Rosario, tell us what your thoughts are around AI technology, specifically around directing patients to the appropriate level of care, and how you think solutions can help in that space.
Yes, thank you. I have practiced most of my career, and I still see patients today. Our biggest challenge is trying to get the patient to the right place at the right time to get the right care. They often call the office, which is often very difficult to get through. The staff behind the front desk are not clinically trained to make an assessment, and our schedules get filled very quickly. This results in delaying appropriate care. This results often in directing them to urgent cares or emergency rooms, which is not the optimal place for them to be, because they have no access to the medical records or past medical history, which is essential to evaluate a patient. And as a result of that, there's also loss of network integrity. In large healthcare systems like ours, patients often will go to an alternative source for their care and then wind up in an alternative hospital and healthcare system. So I think if we've done this in so many things, when we plan to travel, when we plan to go to a restaurant, we do our homework. We decide, what's the driving distance, what's the cuisine, We're going to travel, look at flight schedules, driving distances, and we may take all that information and have a travel agent put it together. So we didn't have this tool 20 years ago. In healthcare, we are still doing it the same old way. I think that giving a patient a tool to do some pre-visit triage will not only help them understand where they need to go, but when they make the call to the front desk, the conversation can be more focused. One of the advantages of Medictor is when they ask you a question, they give you 3 options that you can pick from. When I ask a patient a question, they're not quite sure how to respond to it and very often take me in a different direction. So I do think that this is going to be an essential tool for us to decrease overutilization in the emergency room, to get timely care, and to get care with their personal physicians.
I think you raised such a great point around what we as patients, when we interact with healthcare organizations, we don't always know. Well, the folks that we deal with are not always doctors and physicians and nurses, right? They're folks sometimes that don't have that background, and sometimes are the folks that are trying to direct us on where to go. So I think having a tool to help you navigate that process will certainly be helpful to patients. So I appreciate that thought process there, Dr. Rosario. Let me go to you for a moment, and let's talk a little bit more specifically about your implementation at CMH of our solution, and tell us a little bit about the use case and kind of what kind of specific pain points you were trying to resolve as part of this implementation.
Sure. So actually, we started. I'll give you the brief background. This was one of those classic board member reaches out to CEO to say, I met a guy or I know a guy that I think you guys should talk to. In my role, that very often means I get to talk to them. And so I reached out to Vincent, and we had a conversation. It really was going through the motions because it was this is sort of what we do. We take suggestions and we follow up on them. By the time I was done with the conversation, I was actually really intrigued. I think the biggest thing from our perspective initially, didn't really have a preconceived method for utilizing the product. It was the first that I'd actually really heard about. And the concept of a symptom checker, it was sort of a sexy idea. It was new. It was, something, the only kids on the block with this new toy. And a lot of times, in technology, that's what we're doing. We're trying out new things and seeing where it's going to land us. And at the time, we also had a grant that would cover the implementation that we were trying to figure out. It was an IT grant. We were trying to figure out how to utilize it. We could have used it for telehealth or some other platform. And because we had the money available and it was an interesting concept, we just really weren't sure where it was going to go. I was able to get approval to launch it. But then the pandemic hit and the grant got extended a year. So everybody was in less of a rush and got extended, I think, one more time. I think Vincent and I worked on this for over 2 years before we finally launched. The concept at the time was to have a symptom checker that would be branded, as CMH, that we could really put out a tool for people to use, but we really didn't have a great concept on where it was going to go or what its value was going to be. And over time, as we started to work with it, and I worked with Vincent, and we started talking about marketing and things of that nature, a whole bunch of sort of visions sort of developed where I thought it could have tremendous value. So there's really a lot of there's a lot of bandwidth with a product like this. You know, one of them, as Dr. De Rosario talked about, simply from an access standpoint, which as the pandemic has gone on and staffing has sort of vanished from the face of the earth, all of us are wondering what happened to all the employees. Everybody's short-staffed. The concept of access is actually even a bigger issue. So patients having the ability to figure out whether they really need to go to a healthcare facility, or if so, what's the proper one, to be able to access telehealth, to know where the nearest urgent care center is if they choose to go that route. All of that is a great entry into the system because it really appropriately triages. And as you know, Dr. De Rosario said, we have, you know, most of our entry points are non-clinical people. And, you know, they're just performing a standard set of functions that, you know, that are complex, but they don't have the clinical piece. And a lot of times patients are calling and they think the person on the other end has actually got some, you know, clinical knowledge. So it's a disconnect. So that became a valuable tool. But one of the things that I thought was really intriguing to me is if we were able to get this utilized by a lot of people in the community, it was an opportunity to direct them back into our own health system. So to be able to point out that we have an urgent care here, an urgent care here, there. And so instead of losing them to a competitor or to a different system, this gave us the opportunity to kind of keep them, you know, in-house. If they didn't have a primary care provider, they could click, you know, yes, I need a primary care provider. We'd direct them directly to our website where we have the ability to set up appointments and that sort of thing and get them in to the healthcare system. Outside of that, there's always the possibility that they end up in one of the competitors' markets. It really depends upon, you know, who's the easiest to access and who's in front of them. So Medictor had a lot of different value. And, you know, for us, when I look at it as an individual hospital, we have, you know, 2 urgent care centers. So, all right, so we can point those out. But what about utilizing it for our entire system where we've got 40 urgent care systems? Now we're able to get patients a huge opportunity to direct them towards the nearest facility, but it's a facility within our system. And they don't have to be, you know, in Hudson, New York. You know, they could be, you know, a couple of counties north of us and still get, you know, the same kind of quick access and direction because we have a bigger network to share. So there's a number of variety. And as we did just a little bit of marketing through Google, actually, Vincent and his team really ran most of this because to be perfectly honest, this was something that was just me involved a little bit with our one marketing person because we're a small hospital. You know, Medictor did a lot of the heavy lifting for us, but with very little Google, you know, and I'm not familiar with the terminology, but some of the things that they did, we saw like a 10-fold increase in hits on our website on this product in 1 month. It just took off, and most of the people stay on and finish going through all the questions. We have very little dropout rate, high satisfaction, all the things that that Medictor talked about were true, and they were very easy to work with. So it was it's been a pretty successful project for us, and you know, we're hoping to do bigger things going forward in the future.
That's great to know. And I mentioned that I'll mention that, you know, it was Google ads that were kind of used to help identify patients that are looking to understand what's going on with their symptoms, and then help them locate your landing page and your place where they can go kind of check their symptoms. Real quick question: how long, for the audience, how long have you now been live with the solution?
I think this is year 3. And then there were 2 years in the planning stage, just trying to get it approved to launch.
Yeah.
But so Vincent and I have been working together for about 5 years.
Perfect. Thank you. And thank you for being an early adopter with us. While the solutions have been around for a little while, there's not a lot of prevalence of these solutions yet in the U.S. healthcare market. So you were definitely one of the earlier adopters, and we're very appreciative of that. Dr. Del Rosario, let me go to you. You've evaluated some solutions in this space previously when you kind of starting your journey on this path. Tell us a little bit what you found as you were trying to do your evaluation.
Yeah, I looked at several products, but the product I looked at in depth was Babylon. And I spent a year with them, looking at their product, working with them, even went to London to do a presentation with them. But I came back and told the health system that I didn't think this was right for us. They were trying to boil the ocean. One of the things I realized is that as a very large healthcare system, the Yale Health System has a very robust IT department, but we had a gap. The gap was symptom checker, access, and so on. So Babylon was trying to just sell you something out of the box. I didn't think it was the right fit for us. Didn't think they would collaborate and customize it. And even though I said this a few years ago, I unfortunately turned out to be right, because Babylon went belly up last year. I think they got too big too fast. So that's when I met the folks from Medictor. And my experience with them was totally different. They had a focus on this product. Unlike many other vendors, they were not trying to sell you a whole suite of products. They also were very collaborative. I worked with Dr. Garcia Esquirol, their medical director. One of the things they did was they sent a team to our office to observe the workflow, to see where the gaps are, to see how they could adapt to what we need. And that was really essential, because otherwise you're talking in the abstract. They need to know the US market. They need to know how we practice. We actually did a pilot with them at that time. We had iPads. We actually showed it to patients. We got very positive feedback. We were all set to launch it when COVID stopped us in our tracks. And then we tried to do it again 6 months later, and again, COVID, we had a second surge in both the United States and in Barcelona. And we had to put things on a hold. And then, as many healthcare systems went through complete hold for a while because of some of the financial difficulties most large healthcare systems are in. I can tell you that we are a very large healthcare system with 7 hospitals and 138 outpatient facilities we are located in the Boston, New York corridor, a very competitive market. So it is very essential for us to retain our patients. But patients have options. And if they can't get to see us, they will go to an urgent care center, emergency room with a competitor, and we lose these patients forever. Not to mention the fact that we participate in a lot of value-based programs. When a patient leaves our system because they can't get to see us, even for one visit, the total cost of care escalates because there's a lot of redundancy and repetition. So, I do believe that one of the salient points of Medictor is that they are focused on their product, and they are very collaborative.
Thank you. So you had, I think we know that Epic has kind of dabbled in this space previously. I think you might have evaluated that as well.
Oh, yeah.
Is there anything you could share there?
I didn't even mention Epic because the product was very embryonic. and as you know, Epic is very good at everything else, and you can't be good at everything.
So, Dr. Pope, let me go to you, back to you again. You had recently been interviewed, not too long ago by Healthcare IT News, I believe it was. Yeah, Healthcare IT News, regarding your implementation of Medictor. Can you share with us some of the results you shared with them during that conversation?
Yeah, I mean, I shared with them a lot of the same stuff that we just talked about. I think, it's interesting because their focus is a little bit different. It's healthcare IT. And I think their audience, is a little bit more specialized, unlike the direct patient aspect. I will say that I've gotten feedback from a number of people that have, seen that, and, with increasing questions, but more people in the industry rather than, directly as far as a patient impact. But this is actually, we've had a couple of things where we've been involved with some of these national, outfits with on the IT side. And it is interesting, some of the interest it generates, and sometimes some of the inquiries.
So was there, in terms of impact, do you anticipate, I know that currently you're not interfaced to, I know you're migrating to Epic, right? So you have a current EMR and you're migrating to Epic as an organization. And do you expect that at some point, I believe that you're thinking about doing a higher level of integration with your EMR? What are your thoughts there? And do you expect some additional benefits from that integration?
Well, I'm hopeful. I mean, my role as it changes, I'll have less direct impact on this. And some of the people that I've handed it off to, we're hoping that, that the system will take this to the next level. But I'm not the one that runs that. So what their direct plans are, I can't say for sure. But where I see the impact from a bigger system level is that, there is the ability to offer a wider net from the whole system of all the services that are available, and to provide better access for people, to get people to primary care providers to help them decide urgent care, ER, where is the closest center. But it also then keeps the business. If you go to our urgent care, you're going to get referred to our orthopedic doctor. If you go to pardon me, I'm just trying to mute my phone because it's going to drive everybody nuts. If you go to, the urgent care center and it's not part of the system, then you're liable to be referred out to a different place. And as Dr. De Rosario said, now you're getting scattered care. So most of us are involved in some value-based payment models, and at the system level, we're working on integrating a lot of that, the quality, et cetera, with Epic, because we'll all be on one system. So this fits nicely into kind of that plan. And then, of course, one of the benefits is if you can implement that into the EMR, then as you're collecting data from patients, getting them to the right place, you're also, you have this information in the EMR, which, now they've answered a whole bunch of questions. It would make it easier for a doctor to make decisions, or to have a more accurate history. So there's just a tremendous amount of value throughout. I will mention, just to add on, we did look at Epic. Epic has a symptom checker, but my understanding and I'm not the expert on this. My understanding is twofold. The symptom checkers through the patient portal, which means you have to be a patient in the system already to ask the questions. It's not as robust. It doesn't have all of the aspects that Medictor has. But I look at this product as being valued not just for patients in your system, for patients outside of your system, for patients that don't have, the 25-year-old that doesn't even have a doctor. They don't know where to go. They don't get sick that often. So this is an opportunity to be able to not only get them connected, to get new business, outside business connected and into your system, but by integrating with the EMR, you just add a whole next level of efficiencies and information gathering that I think makes it easier to take care of people.
Great. Couldn't agree more. I know that in interest of time, I want to make sure we leave enough time for the questions from the audience. So I'm probably going to keep it to maybe one or two more questions at the most, so that we leave enough time for those questions. So why don't I go to you, Dr. DeRosario, one more time, if I may. We talked a little bit about driving new patients, et cetera, to your front door, and you talked some about some of the efficiency. But maybe we can spend a couple more minutes on that, especially around the efficiency, and maybe use an example of let's say ED, in some areas where you might gain some efficiency using a solution like this. Do you have any thoughts on that, Dr. DeRosario?
Yeah, I think one of the things that initially we had thought about was using Medictor in the ED to try and do a triage. As we know, only 33%, as was mentioned, of patients who go to the emergency room need emergent care. But very often there's a long wait time, and in the waiting room, there are some really sick patients. Even though most places have a triage with a nurse, it's really impossible to do an in-depth triage. So if you could do a pre-visit triage and then validate that with a nurse. We could often redirect these patients to telehealth if need be, and some EDs now offer telehealth aside. A lot of our EDs do. Secondly, it might be deemed not emergent and schedule them with their own physician for the next day or so. And most importantly, identify those patients who truly have an emergency and need to be get priority care. So that is certainly one of the key things. It'll shorten wait time, shorten frustration. And in the process, we can educate our patients to use the emergency room for what is really appropriate, not to mention the fact that it's so much more expensive compared to seeing your own primary care physician or doing a telehealth visit, which is often the case.
Yeah, totally agree. And I think one of the things that, obviously trying to catch the patient up front and directing them to the right level of care is the most ideal thing. But we all know that patients show up in the ED that may necessarily need to be in the ED. And certainly with low acuity or less urgent cases that come into the ED, having them either visit a kiosk or give them a QR code that they can do on their phone and do a triage on their own will certainly help alleviate some bottlenecks and help organize the ED in terms of priorities. So definitely some benefits that can be seen there. So I wanted to throw out that other use case. Only about 10 minutes left. So why don't we bring in the team or have you come up and see if there's any questions from the audience. And then one other thing I'll mention before we get to the questions is we didn't get into a demo today, and I know some of you were probably thinking, can we see a demo today? We thought it'd be best for you to hear today from some of our clients and some of their experiences and have a high-level overview of the solution, but we certainly want to do a demo for you. So if post this meeting, if you have an interest in seeing it in more detail, please reach out to us. We will love to either come to see you. The census is in New York, I'm in Orlando, but we're happy to come see you and do a demo or do a remote demo, whatever makes most sense. So wanted to make sure you threw that out there. So, Sense, any questions from the audience?
Thank you, Fred, and the panelists. Yes, we do have a few questions. Actually, since we are almost on top of the hour, I had to answer some of them by typing, but there are a few that I think is worth sharing with the whole audience. So the first one is about what demographic groups are most prominent users of the solution. So I think that there is no surprise here. Younger patients are more willing to use this type of solution, as well as women, if we compare between sex, male and women. What is surprising, probably, and quite remarkable is that even older patients are getting more and more used to using virtual digital health solutions, right? And this is something that is not only us seeing this when we analyze demographics, but also what we are hearing in the industry. It was recently published a report from UPMC that they were actually surprised of the use of telemedicine by the elder patients. So demographic, younger as usual, as you may expect, but remarkable also older patients. I do have a question I think that is addressed to Dr. Pope. It's regarding the implementation of Medicare, and it's about if there was any resistance from staff on integrating this type of technology. If you could share a little bit, how was your discussion internally once you decided, look, this is something I would like to do? There was some resistance from the staff?
So I think, there are a couple things. First thing is, you got to get through the chief financial officer, right? Because you got to pay for the product. And we had the grant, and that was not difficult because I think it was a good concept, and we had the grant for it, so it made it a little bit easier. Otherwise, you're really getting into what's your return on your investment piece if you're fronting your own money. And this was, newer to the market, at least from our end. The staff itself, I mean, really, implementation of anything electronic, it's always IT department, right? The IT department gets very nervous when, and in their defense, we do this all the time. We have all these great ideas, and everybody forgets to include the IT department till they're ready to implement. And then you find out there's all kinds of challenges and security issues that you didn't know about. Having been through this a few times and we had time, we worked with our IT department. And I think, Vincent, your team was able to answer every question they had. It was probably the smoothest interaction I've had of any project we've done in that respect, because you sort of anticipated all the things that would be asked. You had documents ready, et cetera. And really all we have is a link on our website. So it's not internal on our servers, anything like that. As far as the rest of the team, there wasn't much of a rest of the team. I had a couple people helping me that worked for me, and they didn't complain. So I can't tell you whether they were thrilled or not, but they did what we asked. We're a small hospital, so there's only a few of us involved. I think most of it was you and I together. The implementation of it was really quite easy. I mean, you guys did all the heavy lifting. I have nothing but positive things to say about that. I've been involved in a lot of implementations, so this was pretty smooth.
Thank you so much, Dr. Pope. There are no further questions. So back to you, Al, for closing remarks. Thank you.
Great. Thanks, Vincent. This has been a very interesting hour as we've dive deeper into this technology, again, fueled by artificial intelligence, which is a very dynamic topic these days within healthcare. AI is, really working through two different channels, if you will, in healthcare, one around automating processes, and the other's more around clinical decisions and clinical inputs, I'll say. And it's interesting that this technology is really combining the two, right? It's looking at how to create efficiencies at a medical center front desk. We heard about it, or in the ER, or through urgent care, or just through a website inquiry, and adding really how can we pre-diagnose and indicate possible direction of where to go next. So most hospital systems now are trying to figure out where do we go with artificial intelligence, and this is kind of a good solution to look into in terms of introducing your system into AI in a very meaningful way, and a way to attract patient loyalty and all the things we discussed throughout the last hour. So I want to thank everyone again for coming today, our panelists. As a follow-up, again, the slides were placed in the chat. They'll also be sent out through email. We will be contacting you to see if you're interested. As you heard earlier, Fred say, very easy to set up a demo. And Haney's has also worked behind the scenes that you're going to get obviously some favorable pricing for the product as well. So again, hopefully today's been very valuable for you, and thank you again, and have a good rest of the day.
Thank you.
Thank you, everyone. Appreciate it.
Thank you.
Have a great day.